Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our inhaler series for asthma. Asthma is one of the most common allergic diseases affecting both children and adults, and inhalers remain the foundation of treatment. They are widely used, well studied, and proven to be both safe and effective. While I have previously covered nearly all FDA-approved biologic therapies for asthma, this series shifts our focus back to inhalers, introducing them one by one. In this episode, we're focusing on Asmanex HFA, an inhaled corticosteroid used for the maintenance treatment of asthma. It is designed to reduce inflammation directly in the airways, the underlying cause for asthma symptoms. Asmanex HFA is approved for patients 5 years of age and older and is available in different strengths, allowing dosing to be adjusted based on prior treatment and disease severity. In this video, I'll walk you through 5 key things you need to know about Asmanex HFA: what it is, how it works, how to use it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Asmanex HFA and who it's for? Asmanex HFA contains Mometasone, an inhaled corticosteroid approved by the FDA as the maintenance treatment for the prevention and control of asthma in adults and children 5 years of age and older. It was initially approved in April 2014 for patients 12 and older, with an expanded indication in August 2019 to include younger children down to age 5, making this medication available across a broad age range. It is important to remember that Asmanex is not a rescue medication. It should not be used to treat acute breathing symptoms or asthma attacks. Instead, it is taken regularly to reduce airway inflammation, improve lung function, and lower the risk of flare-ups over time. Patients should always have a separate rescue inhaler available for quick relief when needed. Second, how does Asmanex HFA work? Asmanex HFA contains Mometasone, a corticosteroid that targets the underlying inflammation in asthma. Asthma is not just about narrowed airways. It is also driven by ongoing inflammation. Corticosteroids help calm this inflammation by reducing the activity of immune cells and inflammatory signals involved in both allergic and non-allergic asthma. Because Asmanex HFA is delivered directly into the lungs, it works where it is needed most, while overall exposure to the rest of the body remains low. It's also important to set expectations. The onset and degree of symptom relief can vary between patients. The maximum benefit may take up to 1 week or longer of therapy. Third, let's talk about dosing and how to take Asmanex HFA. Asmanex HFA is taken twice daily by oral inhalation, ideally at regular intervals. It comes in 3 strengths: 50, 100, and 200 micrograms per inhalation. For patients 12 years and older who are not already using an inhaled corticosteroid, the recommended starting dose is 200 micrograms twice daily. For patients transitioning from oral corticosteroids, higher starting doses, such as 400 micrograms twice daily, are recommended. The oral steroid should be tapered gradually under medical supervision, with close monitoring for worsening asthma symptoms or signs of adrenal insufficiency. For patients who do not respond adequately after 2 weeks of therapy, the dosage may be increased under a doctor's guidance to provide additional asthma control. The maximum recommended amount for patients 12 years and older is 400 micrograms twice daily, although patients may be managed at lower doses. For children ages 5 to 11, the recommended dose is 100 micrograms twice daily, which is also the maximum dose for this age group. If asthma symptoms do not improve or worsen despite treatment, patients should contact their healthcare provider to reassess and adjust the management plan. Once good control is achieved, the goal is to step down to the lowest effective dose to minimize potential side effects. Proper inhaler use is essential. Correct priming and inhalation technique are key to ensure the medication reaches the lungs and provides full benefit. Detailed instructions are available in the Instructions for Use section of the package insert and on the official website. Extra caution is also needed in certain situations. Patients with moderate to severe liver impairment may have increased systemic exposure to the medication and should be monitored for steroid-related side effects. In addition, strong CYP3A4 inhibitors, such as certain antifungal medications or HIV treatments, may increase systemic exposure to mometasone. Reviewing all medications, over-the-counter products, and supplements with a healthcare provider or pharmacist is always recommended. Fourth, let's review important warnings and precautions. Hypersensitivity reactions, including anaphylaxis, may occur. If symptoms such as trouble breathing, skin rash or hives, or swelling of the face, mouth, and tongue occur, stop the medication immediately and seek emergency medical care. Sudden worsening of breathing, coughing, and wheezing, known as paradoxical bronchospasm, can occur with inhaled medications. If this happens after using Asmanex HFA, treat it right away with a rescue inhaler. Asmanex HFA should be stopped immediately, and alternative treatment should be used. Because Asmanex HFA contains a corticosteroid, it may affect the immune system and increase the risk of infection. Contact your healthcare provider if you develop signs of infection, such as fever, chills, worsening fatigue, new pain, nausea, or vomiting. Patients should avoid exposure to contagious illnesses like chickenpox or measles and discuss any past infection or exposure with their doctor. Inhaled corticosteroids should be used with caution in people with current or past tuberculosis, untreated systemic fungal, bacterial, viral, or parasitic infections, or herpes infection of the eye. In addition, inhaled corticosteroids can cause a fungal infection in the mouth or throat, called thrush. Rinse your mouth with water and spit it out after using Asmanex HFA to reduce this risk. If thrush develops, treatment may include antifungal therapy and temporarily stopping Asmanex HFA. Using Asmanex HFA at high doses or together with other steroid medicines for asthma, allergies, or skin conditions may increase the risk of systemic steroid effects, including hypercortisolism and adrenal suppression. Patients should be checked for other steroid use and monitored for these effects, and treated if they occur. If you're switching from another steroid regimen, such as systemic corticosteroids, to Asmanex HFA, the transition needs to be managed carefully. Rapidly tapering or stopping a higher dose of steroid and moving to Asmanex HFA may cause symptoms of steroid withdrawal or adrenal insufficiency, or allow previously stabilized conditions like asthma to flare. Your doctor may choose to taper the prior steroid gradually and monitor for symptoms while introducing Asmanex HFA. Long-term use of inhaled corticosteroids like Mometasone may contribute to the development or worsening of glaucoma and cataracts. Patients who develop eye symptoms or with a history of eye problems, including elevated eye pressure, glaucoma, and cataracts, should have regular eye exams while using Asmanex HFA. Any new or worsening vision changes should be evaluated promptly. Prolonged use of inhaled corticosteroids may also lead to bone weakness. While the impact of small changes is unclear, people at higher risk, such as older adults, postmenopausal women, smokers, those with poor nutrition, limited mobility, a family history of osteoporosis, or long-term use of medications that cause bone thinning should be monitored for bone loss and treated if needed. Lastly, corticosteroid use may slow growth in children. Pediatric patients should be kept on the lowest effective dose needed to control symptoms, and growth should be monitored regularly during treatment with Asmanex HFA. And finally, let's review the side effects and safety. In clinical trials of adults and adolescents ages 12 and older, using the 100 and 200 microgram strength, the most commonly reported side effects were headache, flu infection, bronchitis, and inflammation of the nose, sinus, and throat. In children ages 5 to 11, using the 15 microgram dose, the safety profile was generally similar to that seen in older patients. There have been no post-marketing adverse experiences reported to date with Asmanex HFA. However, another formulation, the Mometasone dry powder inhaler, has included additional reported adverse events. Although it is difficult to determine how often this occurs or whether they are directly caused by the medication, these reports highlight the importance of stopping the inhaler and consulting a healthcare provider if new, persistent, or worsening symptoms develop. And there you have it, 5 key things to know about Asmanex HFA, an inhaled corticosteroid that offers a potent effect in controlling airway inflammation while helping improve lung function and support long-term asthma management. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.